Right. Welcome everybody to our June live webinar. This month, we are going to be talking all about acne. So identifying acne, we're going to talk about the disease pathway of acne, some things to consider when treating acne, and then treatment options with ClarityRx. For those of you who don't know me, I am Danielle Rousseau, the Director of Education for Clarity. I'm also a licensed esthetician, and acne is a skin condition that holds a very special place in my heart as someone who also struggled with acne and continues to monitor and control those acne breakouts personally, also treating many people, both family, friends, clients in the past with acne. So very excited to dive in deeper on this skin condition. So here are our targeted solutions for ClarityRx. Now, this is a snapshot, and as we dive in a little bit deeper into the complexity of acne as a condition, you'll start to kind of look at different products and ingredients and really become your own chemist when treating your individual clients. So acne is an extremely complex skin condition that what works for one client may not work for another. What worked for you may not work for a friend or a loved one. So it really is I hate to use the word trial and error, but you are trying different things, but it's in a well-educated approach. So looking at ingredients and then kind of building up to look at the product itself, and always bearing in mind how that skin condition, how these acne breakouts have come to be within the skin will help guide you in the right direction, and then analyzing that skin. When your clients are coming to you and they have acne breakouts, you see a couple different things. One, you have clients that truly have your more severe types of acne. Then you have those clients that maybe it's more of a cyclical type breakout, and then others, they have one breakout here and there, and they like to think that they have acne, and they may be using incorrect products that could potentially be triggering and causing their skin to be worse than what it actually is. So that's where you and your expertise comes into play when you are cleansing the skin, conducting your consultation. The more questions that we can ask, diving in deeper into what they're currently using at home, what they've tried in the past, how often their skin tends to break out, what types of breakouts do they usually have, because the way that their skin is presenting when they come see you that day, it may not necessarily be indicative of what their skin looks like on a more regular basis. So we want to dive in a little bit deeper, and something that I am going to touch upon later on during our webinar is some lifestyle choices as far as dietary and that sort of thing that we walk a fine line. So there's certain ways that we can approach this subject with our acne clients without kind of gearing into that nutrition realm, but also finding more of a comprehensive approach of maybe planting the seed or allowing your clients to think a little bit more about some of their personal lifestyle choices. Maybe it's food, that sort of thing. So we will talk about that. But as I mentioned, acne is the most common skin condition in the world. It is the most common skin condition in the US. And the majority of people, so 85% of people, will experience acne at some point in their lives. And it's very old school thinking of it's a teenage skin condition. Now we're seeing, males, females, all suffering from breakouts into, it might be teenage years, it might be later on in life, their 30s up into their 40s. So this is what's driving a lot of people in to seek help with their skin. Now, 50 million Americans have had acne at some point, and 15% of them have had acne so bad that it can result in scarring. So not only is this a condition that, we struggle with kind of personally, if we do have that skin condition, it does take a toll on your self-esteem and your self-confidence. We've all been there. We've all had that breakout, and it tends to come in the most inopportune time. We have a job interview or a dance or something like that, that we all of a sudden have this giant breakout. We're insecure, we're self-conscious about it. So by helping to treat those acne breakouts, we truly are making a change and improvement in that individual's self-esteem and self-confidence while also treating their skin. Now, during this webinar, we're going to talk about the causes of acne, biggest challenges that are faced when treating acne, and recommended treatment plan. So acne, one thing to note, it is a chronic condition or disorder of the skin. Chronic means that there is no cure. So you can treat acne breakouts, you can control those acne breakouts, but you cannot necessarily cure acne itself. There are lots of different modalities and things, ingredients, both home care and following that regimen, treatments in the treatment room, such as your LED lights and chemical peels and facials and all of that, that will help to control those acne breakouts. And it's all going to tie back into the main causes. And when I can't stress enough, when we are approaching acne, we need to set those expectations for our clients, but also allow your clients and communicate with them that we are on this journey with them and we're going to go through it together. It's just going to take some time. And we want to set those expectations because acne is a very frustrating skin condition, as we all know. And by the time clients are coming to see us as providers, more often than not, they've tried a lot of other things at home and they're frustrated. So they thought that they were doing exactly what they were supposed to do, but yet they're still having these breakouts. So it's we want to approach it very delicately and cautiously while also engaging and asking those questions of what have they done, so that way we can better treat them and really understand and communicate what that pathway looks like for their skin. And while we're just seeing that big blemish or those blemishes on the face, it didn't just happen overnight, even though we feel like it did. So acne is characterized and marked by an eruption of pustules, papules, comedones, and cysts. And it is tied into increased sebaceous or oil sebum production, and inflammation is very, very common, especially when you're looking at those more severe cases of acne. So the four main causes of acne is increased keratinization. Then you have an increase of sebum production. You'll have inflammation that's in there, and then you have an increase of P. actis bacteria. By having that increased sebum production, the increased keratinization, so that's going to be, that shedding of the keratinocytes within that follicle, it creates a great breeding ground for bacteria. When there's bacteria present, that triggers our inflammatory response for our skin to go in there and repair itself. So that's where that inflammation is occurring. All right. So let's look at the pathogenesis of acne. How do we go from healthy skin, not a mark, not a bump on it, to potentially seeing cystic acne? So this first picture on the left-hand side, you have your hair shaft, you have your sebaceous gland, and it's normal, healthy skin. So that first step in the pathogenesis or disease pathway of acne, it can have an open comedone. So this is where that plug starts to happen. So the dead skin cell or the keratinocytes within that follicle are actually shedding on a more rapid basis. Now, an open comedone means that it's open out into oxygen. So it's basically oxidized sebum, and there's excess sebum in that plug of the follicle. And that openness is what's and that oxidation is what's giving it that darker color. Now, oftentimes open comedones or blackheads can be confused with sebaceous filaments. So sebaceous filaments, those typically happen right around the T-zone area. They have more of a gray-like appearance to them, but it's not considered a blackhead, but it could potentially lead or progress into becoming an open comedone. So there's no plug on this. The sebum, excess sebum keratinocytes within that follicle are open to the air and it's oxidized. That's what's creating the black color. Then you progress forward to a closed comedone. So this is where all of a sudden now that those dead skin cells are not turning over. So it creates a plug on the surface of the skin. But down below, you still have that increase of sebum production and that increase of that keratinization within there, but it's not able to get out or release itself. So that's where you start to notice that you have that bump forming. So you have those keratinocytes that are on top of the surface, creating a perfect breeding ground for bacteria. So then it progresses forward into what we call inflammatory acne. This is where you have that the bacteria starts to multiply and proliferate. You have increase of sebum. So this is going from, you go from an open comedone, closed comedone to now a papule, pustule, and then it will progress into, or potentially, not always, but has the potential to progress into cystic acne. Cystic acne, there is a significant amount of that P. acnes, a significant amount of inflammation. You'll notice by the image here that inflammation now in the cystic acne is carrying through deeper within the skin and it's surrounding more of that follicle. So when you are looking at terms of the higher, more severe types of acne, this is where scarring is extremely common due to the presence of excess inflammation in the skin. So for acne, it is broken down into two categories. So you have your acne simplex, and then you have acne vulgaris. Acne simplex consists of your grades 1 and 2 acne. Grade 1 acne is simply open and closed comedones. You don't necessarily have that inflammation or inflammatory connection within grade 1 acne specifically. Then you have grade 2 acne. So grade 2 acne, you still have those open and closed comedones. Then you start to see some papules and pustules. Your higher grades of acne or your acne vulgaris is going to be your grades 3 and 4. Grade 3 acne, open and closed comedones, inflammation, bacterial lesions, and scarring is very, very likely. And then in grade 4 acne, you have, this is where those deep cysts and nodules start to form. The skin is painful to touch. And this is one of those conditions and types that if you have a client coming to see you that has grade 4 acne, medical prescription intervention is highly recommended. That's not to say that it totally cuts you out as the esthetician. We pair really, really nicely together. It's just one of those things that we want to understand our scope of practice and what the best treatment option is. And when you see this deep cystic, nodular, highly inflamed acne where scarring is extremely, extremely common, we'll definitely want to refer our client to go see a board certified dermatologist. Now, there are different types of acne, but tying into the main causes. So regardless of the type of acne, for the most part, it's going to follow this same kind of 4-step process and that pathogenesis for those breakouts. So you have hormonal acne. Now, this hormonal acne is number 1 kind of listed on here for a reason, because almost all acne has a hormonal component. So if you think about it, your sebum is triggered by hormones. And so there's always going to be some sort of hormonal component to acne. Now, when you are looking at specifically acne that's around like the chin and the jawline, that is a classic example of hormonal acne. Then you have acne cosmetica, inflammatory acne, asphyxiated acne. This is that acne, if you're looking at it, it almost looks like there's saran wrap over the skin, and then you have these breakouts underneath it. So there's just no oxygen or anything getting into the skin that's clogging those pores. Then you have bacterial acne, cystic acne, and then finally you have systemic acne. So this is where we're looking at somebody has back knee, chest acne, acne down the arms. That is a classic sign of systemic acne. Now, here is I've led with this before and after photo for a reason. So bear with me. And I think it's one of those things that it can be a frustrating condition to treat, but we can make significant improvements in treating acne for our clients. And some of these before and afters they've seen have just been fantastic. And here is one of them. So this is just after 1 month of receiving 2 of our salicylic acid chemical peel treatments. The client at home was using Sleep It Off with Fix It, Clears It, and sunscreen. So a very, very simplified approach, but it really shows that you don't necessarily need a lot. You just need kind of that right combination, and pairing it with home care products along with professional treatments is going to be the key to success. So treatment plan for acne. We want to, again, considering the main causes of acne, we want to increase that cell turnover. So we want to be able to control and manage that intercellular turnover, as well as not allowing that plug to begin with in the first place. So as that keratinocyte or cell turnover starts to slow down, if we are prone to acne, that creates a perfect opportunity for that risk of acne to form and then progress into a more severe type of acne. We want to control that sebum production, and notice that it says control, not stop or eliminate or completely dry out the skin. That is one of the battles and one of the challenges that it comes to treating acne clients, is that it's more of a psychological kind of approach to it, where they automatically think, and clients with acne think that the more oil they have on their skin, that's causing their breakouts. So that leads them to using harsher products, maybe over treating, using too many products. So now they're stripping the skin of that natural barrier, leaving it open for more bacteria, more inflammation. They're actually exacerbating that condition. So we want to find that balance of, yes, they have excess sebum, so let's control that to where it's in a normal range of sebum production to keep that barrier function intact, but not have it be extra. Then we want to kill that P. acnes bacteria, reduce that inflammation in there, and then protect the skin. There are studies out there showing that UV light can actually make acne worse, because again, it's breaking down that barrier. It can dry the skin out, and it leaves it more susceptible to bacteria, outside invaders that then can make the skin worse and more inflamed. So sunscreen typically is one of the struggles, along with moisturizer or hydration for acne clients, but a little bit goes a long ways, and it all comes down to finding the appropriate one for that client, and also educating them that not all oils or cream-like consistencies are bad, that it's really creating a homeostasis and a balance within the skin that's going to lead to the successful treatment of those acne breakouts. Now, a couple things to consider and to ask. A lot of times, because there is such an inflammatory component into acne, asking their, asking the client if they notice that, certain times of the month, or if they are, or certain foods may potentially trigger. Now, there's still a lot of controversy and back and forth as far as does, different foods and everything like that cause or create acne? Does it not? And the more information that's out there, it's not necessarily, if you aren't prone to acne, if you eat high simple sugars and complex carbs and lots of dairy, it's not going to cause acne in the skin. Now, if you have acne, there are some things that dermatologists have found could potentially make those breakouts worse. So lots of dairy. So that's usually one of the big things that they will ask you to ask their patients to cut out is dairy. So just even asking them, like, what is their normal food routine and intake? What are some of their favorite foods that they like to eat? And then, okay, I love to eat pizza. I love to eat pasta. All right, after that, do you notice, like, how is your skin maybe 2 weeks after you have that pizza and pasta? Do you notice anything? And maybe not. And just even asking them to create a simple food diary can help. The other thing is picking. So picking, it's like I said, it's a psychological condition that we see a breakout on our face. We want to pick and we want to remove it. And we think by picking that breakout, we're actually doing and treating the skin and making it better. But what happens is, as we all know as estheticians, they can actually be making their breakouts worse. So as hard as it is, the less they touch their skin, the less they try to do extractions, the better off their skin is going to be. Because if they are not extracting their skin properly, they run the risk of blowing out that follicle with that bacteria. And even if there's just a little bit of bacteria that escapes out the bottom, that can then spread to the surrounding pores. And now that acne has the potential to spread. If they aren't washing their hands before they attempt extractions, if they aren't cleaning the area after they extract, they are potentially spreading that bacteria and making it worse. And while they might have a short sigh of relief because that breakout's gone, they'll notice maybe a couple days later, a week later, they have kind of in that same surrounding area, they have more breakouts. So making sure that they do not pick or try to pop their breakouts will be a huge help with treating the acne breakouts. And then not over treating. So we have a lot of different products that are designed to treat acne breakouts, and it's finding the right products that will work for the skin. So for the cleansing step, if somebody is more on glycolic acid is a fantastic product for acne skin. So if you're looking at glycolic acid as a molecule, it is a very small alpha hydroxy acid. If you look at acne, and kind of one of the main causes is that keratinization within the skin. And so with acne, with glycolic acid, it's a small molecule, so it's able to penetrate into the skin and it will increase that cell turnover within the skin. So our cleanses needed, or our, I don't have it on here, so just kind of simplicity, the Restore It could be a great option for more of those lower grades of acne. So looking at acne grades 1 and 2, your open and your closed comedones, that cleanses me with the glycolic acid is a great cleansing option. Then you have your Down and Dirty. So Down and Dirty is our detoxifying charcoal micro exfoliate that also has it has activated charcoal in there. Activated charcoal is a really cool ingredient because not only does it provide that abrasive kind of physical exfoliating medium, it also works as a magnet. So as it's rolling over the skin, knocking off those dead skin cells, opening up the skin so that way a plug cannot form. It's attracting that excess sebum, dirt, and debris that's within the follicle, and it's being able to attach to the activated charcoal. And then when you rinse off down and dirty, that excess dirt, debris, and sebum is going to rinse off with it. So this is something that you can use daily. Now, one thing to note for our down and dirty and any physical exfoliation, if you have somebody that has your high grades of acne, you want to be very, very careful with using physical or any sort of manual exfoliation. Because what you don't want to do is if they have those pustules on the surface of their skin, they're using this manual scrub or exfoliation, it can break open and then that bacteria can spread on the skin. So just be careful with not having somebody who has the high grade, so grade 3, 4 acne. We're not going to want to use a physical exfoliant, but your grades 1 and 2, kind of teetering, I would say like 2.5, no pustules, open, like very obvious pustules on the skin. Physical exfoliation is fantastic at incorporating into their daily regimen. Then we have Fix It. So Fix It, this is all of our assets. So Fix It and Restore are some of our favorite products, and it really does embody who we are as a company with Clarity. It's very clean, very simple. Think of this as your at-home version of a chemical peel for your clients. So Fix It in particular has 2% salicylic acid. So salicylic acid is going to be a beta hydroxy acid that packs a powerful anti-inflammatory aspect to it, while also increasing that cell turnover and increasing and decreasing the excess keratinization within that follicle. So looking at, your higher grades of acne, as long as it's not an open wound, Fix It is fantastic because you're getting that anti-inflammatory aspect, but you're also getting that exfoliation. So this is a product that you will apply at nighttime. You'll wash your face, then you'll use a cotton round or cotton ball. You'll saturate it. You'll wipe the skin almost like an astringent or a toner. Have your client throw it away. Then it will be left on the skin. It's not uncommon to feel some tingling, almost feels like itchiness on the skin. That's perfectly normal. So just let your clients know that that's to be expected. They're not having a reaction to it or anything, but Fix It is phenomenal at controlling that sebum production, reducing the inflammation, and increasing that cell turnover. Your client is coming to you to receive a chemical peel, like the salicylic acid exfoliator, 15%. Then for their home treatment, they're taking that Fix It home to be able to continue that treatment in between their visits. And it's at a percentage that is suitable for the client to use at home. Then they're coming back to you to get the stronger, more advanced exfoliation within that salicylic acid peel. The other product here is Clears It. So Clears It has witch hazel in there. There's salicylic acid. This one is a product that don't leave home without. For those people that you just have those pesky breakouts that pop out of nowhere, instead of picking it, it's great to be able to have a product that you really just, what stirs people to pick is they want to do something, want to treat it. They want to help this breakout to go away as quickly as possible. So Clears It is a on the spot, it has a very convenient applicator. That applicator itself is antimicrobial and antibacterial, so you don't have to worry about putting it on the skin on a blemish and putting it back into the tube. It is designed to kill bacteria, so no bacteria can be transferred. And it's going to, that witch hazel is anti-inflammatory along with that salicylic acid. So it's that quick targeted treatment. You can use it morning and night and 3 times a day throughout the day on that specific spot. Now, spot treatment, we all know about spot treatments. Our clients know about spot treatments. We're bombarded. But the way that the applicator is and the way that it's packaged, truly is designed, and it helps to only target that breakout. So that way we're not necessarily over treating the surrounding tissue. Then let's talk about balancing the skin and creating that not over drying or over stripping. So Get Balanced is a phenomenal product for our acne clients. And that's going to be your adolescent acne, your adult acne. Mastine is fantastic, but Get Balanced has a probiotic in there. So bacteria, especially when we're talking about acne, we're talking a lot about killing that bacteria. But we do need some bacteria on our skin. We have lots of bacteria. It's just when it gets out of balance and we have the excess bacteria, the bad bacteria, that's where problems arise. So when we are using all these products treating acne to kill that bacteria, we want to make sure that we're restoring that balance and with that skin's microbiome. When we have that healthy balance of good and bad bacteria, that's where the skin really will thrive. So similar to if you're taking an oral antibiotic, your doctor will recommend that you take a probiotic to help to protect your stomach. Same thing with your skin. You're using a lot of products that are killing and treating the bacteria on their skin. You want to use a probiotic to balance out and restore the good bacteria. The other great thing about this product in particular is it does have hyaluronic acid in it as well. So it's a hyaluronic acid base. Not only are you adding and balancing out the bacteria on the skin, you're also adding that hydration without it feeling heavy or without it feeling for your clients they don't want to use it, or they don't want to use it, feels tacky, they think it's going to cause them to break out. It's very, very light and it feels soothing to the skin. It's also going to help to treat their breakouts and strengthen that barrier. Then you have your daily dose of water. So daily dose of water is 100%. It's your pure hyaluronic acid, plant-based hyaluronic acid that's just providing that necessary hydration. Now, you don't necessarily need both of these products for your acne patients, but this is something that you do have the option of. You feel like you're adding, and there's a lot of antibacterial, Maskne kind of tend to lean more towards the Get Balanced. Daily dose of water, just think if they truly just need extra hydration in their skin, then the daily dose of water is a universal, fantastic option to be able to provide. Then weekly at home. So in addition to your exfoliants, we also have it's rehab mask. So it's going to be a Mediterranean detoxifying mud mask. They can use this, 2 to 3 times per week. It's not going to over dry their skin, but it does help to detoxify, pull out those that excess oil. So there's clays in there to where you're not going to have that excess sebum production, but again, it's not going to strip or over dry the skin to where we can almost create not an ideal environment. The other thing there's Mediterranean Dead Sea mud within that. So that's the Mediterranean mud mask. It's Mediterranean Dead Sea mud. It's soothing inflammation. It's rich in minerals and essential nutrients to help to reduce the appearance of pores and just provide, not only is it taking away and detoxifying the skin, it's also putting back essential minerals and things into the skin as well. Then another mask that would be fantastic for your more inflammatory acne. So think of your higher grades of acne, not necessarily just your open and closed comedones. If there's no inflammation present within the skin, inflammation that is present, Return to Calm CBD mask is a phenomenal option to be able to calm and soothe that redness, that excess inflammation, irritation within the skin. They will use this, 2 to 3 times per week. Leave it on 10 to 15 minutes. This has Pinus pinister in there that is a powerful antioxidant that will, so not only is the CBD reducing that redness and inflammation, that Pinus pinister also works to support the healing process in the skin and reduce that redness. So that's another great option for more of your inflammatory type acne. In the treatment room, so we have quite a few options, and I didn't necessarily, Sleep It Off mask was another one. Sleep It Off mask is going to be your retinol alternative, so your blue-green algae. That is a great option for acne. So there's a couple different things that you can do in the treatment room. Really going to highlight 2 of your protocols. So we have the detox facial, and then of course you would want to, if they're fighting acne, you would want to pair that with the blue LED light. So the blue LED helps to kill that P. acnes bacteria. And then with the newer shipping LED lights that you see, the image that's on your screen here, that also does contain a few red LED lights in there to help to treat the inflammatory portion of acne. So your higher grades of acne that has the inflammation in there. There are some red LEDs in combination with the blue LED lights. So you're killing that bacteria, and then the red stimulating that circulation and promoting that healing process. You can see, so I have gotten a couple questions as far as why would we have Balm It Off in the detox facial, and it's very simple. So oil cuts oil. And I know a lot of times we see like, oh, I have super oily skin, I want to stay away from oils. But when you're looking at a balm or a pre-cleanse, that oil within the balm is helping to break down the excess oil on the skin. So it does serve as a fantastic pre-treatment step for those more oily skin types. There's also ingredients in there, so the bergamot and sweet orange and all of that, that does have antimicrobial properties and antibacterial properties too. Then you'll choose. So cleanses needed, you have the option of cleanses needed and cleanse daily. And then as far as your peel away the years or Senzyme. So when you're choosing which exfoliant you're going to do, think of Senzyme as a whole, and Senzyme is going to be more for your sensitive skin. So if you have somebody who has more sensitized, inflamed skin, that's probably going to be the more appropriate exfoliant for your client to use. Then if you have somebody who has a little bit more resilient, thick, oily skin, those breakouts, then Peel Away the Years is going to be a great option. So pumpkin does have some other vitamins and nutrients. There's yams and other things in Peel Away the Years that help to treat and increase that cell turnover within the skin. Finishing mask, you have your rehab mask. There is an option here. So I want to call this out. This has been added not too long ago. You do have the option to put a drop or two of, so I guess it's technically an 1/8 of a teaspoon of Fix-It into the rehab mask. So you'll whip that together. You'll apply the mask on the skin, allow it to sit. But this now is going to incorporate an additional hit of salicylic acid for more of that resilient skin type for your detox facial. So that's a fantastic option that has recently been added. Definitely when it comes to treating acne, LED upgrades, that's really where I would start. Always positioning, adding on that LED. It's going to take their treatment to that next level with killing that bacteria and stimulating that healing process. Then you have your facial with a peel upgrade. So we talked about salicylic acid as the exfoliant initially, but thinking of looking at, maybe that adult acne has really dry skin, lactic acid, the 15% lactic acid chemical peel is a great option for that dry acne. So salicylic acid is attracted to oil and it goes after oil. So it's lipophilic. Then you have, so it's great for your, inflamed, more oily skin. If you have that dry adult acne, lactic acid would be a great option, at least to start with for them. And you'll see some great improvements there. All right. For the month's promotion, or for our gift with purchase promotion this month, I wanted to make sure that we all knew that this was going on first and foremost, but I wanted to tie it into more of your acne skin. So these products for your clients in particular, if they purchase $100 or more in Clarity products, they will receive a $75 gift that will enhance their regimen. So the 3 products that are in here are Cleanse Daily, Take It Easy, and Rehab. So when you're looking at acne specifically, Take It Easy. Sometimes they'll get asked about that because it's not necessarily like rosacea, but again, tying it back to that inflammation or excess inflammation and as one of the kind of causes of acne breakouts in conjunction with the other 3, we want to calm the skin so that way they do not have that excess inflammation. There's also the Take It Easy is in a hyaluronic acid base. So you're adding some extra hydration in there. You have that detoxifying mud mask to be able to draw out this, especially in the summertime. We have increased humidity, increased heat. We're outdoors more, so we have more of that dirt and debris that our skin is being exposed to. Rehab mask will help to detoxify and treat that skin. Appropriate for all skin types. All 3 of these products are, just more so highlighting it since it is an acne training today, highlighting it more on how it fits for your acne clients. But these are universal treatments and universal products for your client to use. So that is going on for the entire month of June. Contact your customer success specialist and they'll be able to provide more information for you. All right, and I see that there's a question here. So I'm gonna go ahead into the questions and make sure I get all of these answered for you. And yes, this webinar will be recorded so that way you'll be able to listen back to it. So I have a question here. So with the detox facial in Canada, find it confusing with the rehab mask and blue LED light. So great question. I'm glad you asked that. So this is when combining the LED light with rehab mask. Traditionally and in the past, the protocol was to apply the rehab mask, then do the LED light on top of the rehab mask. With our latest protocol update, we have changed that. So that update came out in Canada at the end of March, and then in the US, very beginning of April, so basically the same time. We have switched that to your point exactly, that the light's not able to necessarily penetrate through as effectively through a darker mask. So with the old protocol, we set a translucent layer so the light was able to penetrate into the skin. However, that translucent to me means something different to you, means someone different, one of your colleagues and in the next treatment room. So in order to maximize the efficacy, the absorption, create consistency within every single treatment room, the US and Canada, we have changed that protocol. So what you will do is you will apply the rehab mask first. You will leave it on the skin. That's when you will perform kind of the neck and shoulder massage. Then you'll remove that mask. And then you're going to apply the hydrator. So in the detox facial, it's going to be your daily dose of water. You'll apply your daily dose of water from the hydrate, lubricate, and protect step. And then you will finish, then you'll perform the LED light. So the mask is no longer on the skin while you're performing the light. You'll apply the mask, remove the mask completely, apply daily dose of water, apply the goggles onto your client, make sure their eyes are protected. Then you'll perform the LED light service. That will still be your 6 zones, 30 seconds per zone for a 3-minute total treatment time. Then you'll finish with your moisturizer, easy on the eyes, and the sunscreen. So great question. Thank you for asking that. And we have made that change. All right. Any other questions? Okay, well, thank you all very, very much for joining. I know acne can be a stubborn condition to treat. We have lots and lots of tools and resources at our fingertips. Managing expectations for your clients. One thing I do want to make sure I mention, let your clients know that the acne breakouts could potentially get worse before it gets better. If they have a lot of gunk trapped underneath their skin, it has to come out somehow. So as you're increasing that cell turnover and you're killing that bacteria, the skin can go through a purging process, and that purging process can happen up to 6 weeks. So just tell them up front, be patient, commit to it, stick with it, and we will definitely help to reduce and treat those breakouts for them. So thank you. Any questions at all, please let us know. We are here to help. Oh, looks like we have a couple more questions here for LED lights. So LED lights, they're not necessarily updated. We're just a different model. So they are, instead of being plugged into the wall, they are now cordless. They have a different treatment size head. And for the blue LED, that's when it's going to have a little bit of a red light in there. But other than that, it's treated the exact same efficacy as the other ones. The red handpiece has 2 settings. So it's going to be red LED. You'll click for the second setting, which is an amber LED. And then you still have your green LED for hyperpigmentation and discoloration. And then you have your blue LED for acne. All right. Well, thank you guys. Have a wonderful rest of your day. Please reach out to us if you need anything at all. And thank you for joining us on this month's webinar.